Hello friends, hundreds of men visit my clinic in New Delhi, India every year looking for a big dick. They're looking for penile enlargement in terms of their length or in terms of their penile girth. Penile size is something that every man is dissatisfied of, and every man out there or anywhere in the world wants a bigger penis. But is it a reality or is it a possibility that we can give a bigger penis to a man? And if so, then what are the options that a man has? So hi friends, I am Dr Vijayant Govinda Gupta from New Delhi, India, who is a men's health specialist and an andrologist, and I like to keep things simple. I like to keep things simple and casual because I like to be a friend to my patients rather than a doctor, because when I cure them or when I talk about penile enhancement or if I talk about penile reconstructive surgeries, then the man is afraid for the results. But if we are able to give them a good result which is affordable and which works, then the man feels happy because now he has what he desired. But in this world of so much scams and so much frauds and so many treatments that don't work, it becomes very difficult for men to navigate through the maze of technical terms and literature to be able to find good treatment for themselves. So this video today is going to help you navigate through your options for a penile enhancement and what options do I offer at my center in India for this particular requirement of men. So penile enhancement is defined as any procedure, surgical or non-surgical, that can increase the length and the girth of an adult male penis. There are three kinds of approaches that are available to do this. One is the non-surgical medical approach, second is a non-surgical injectable approach, and third is the surgical approaches. So in the non-surgical, non-injectable approaches, we have medications, we have adjunct therapies like penile traction, vacuum pumping, which can give results to men in two scenarios. If there are men who because of disease have lost some length due to their erectile dysfunction or due to hypoxia or due to Peyronie's disease, penile traction, vacuum pumping, PDE5 inhibitors and use of HGH and growth hormones can help them regain back their lost length. If there are younger boys who have still not matured, then use of testosterone therapy, use of HGH and use of other injectable therapies along with the use of penile traction and vacuum pumping, if done right, can help them extend their penile length by 20 to 25% safely. These injections do not work for everybody, and these hormonal inductions and these medical regimens may not work for everybody, but in men who are dedicated, men who are able to do these maneuvers and these exercises with confidence and who do them consistently, definitely get consistent gains which last for long terms. These gains are stable, these gains are good, and these gains may last these men for a lifetime if done properly. But if these therapies are used indiscriminately without medical supervision, they may lead to many complications, injuries and even induction of erectile dysfunction by over-aggressive use in untrained hands. So many men who come to my clinic who are in the almost normal range can benefit from these therapies and gain an inch or two depending upon their requirement. If your requirement of penile girth and penile length is more than what is achievable by conservative methods, then there are injectable solutions available. These injectable solutions may vary from P-shots or PRP therapy, VEGF or VEGF therapy. These may also include Botox injections. They may also include hyaluronic acid injections in the glans and in the subtunical space. They may also include fat grafts or lipid injections and then stem cells. Each of these therapies have a different advantage, a different cost structure and different benefits that men may get by their use. At my center, I am more in favor of using P-shots along with penile tractions, along with the use of hormonal cocktails to help men increase their penile size. Stem cells is an evolving field, and the availability and the results of stem cells are not clear still to justify the cost. Use of fillers or hyaluronic acid fillers in the subtunical space and the glans definitely gives very good girth enlargement, but it is a temporary solution which is usually reserved for men who can afford it, because the fillers used are usually very expensive and the quantities required are large. More stable fillers like PMMA or other silicone fillers are not expensive, but their results are controversial. Even though they may lead to a stable size increase, they are again having a lot of complications which include graft failure and skin necrosis. I have experience with these fillers, but I do not routinely recommend them because of their associated complications. Fat grafting or use of lipolyzed fat injections in the penis to increase girth definitely help in girth increase, but the girth increase that comes on day 1 may not last at day 30 or day 60, but still most men will be able to achieve 25 to 30% girth increase in their penis after fat graft injections, and it is a treatment modality that I recommend for men with very thin penises and who do not want to first try or who have already tried and failed more conservative measures. The only non-surgical injectable method approved right now for length increase would be PRP along with a penile traction therapy lasting from anything between 6 months to a year, along with vacuum pumping, in which men can look at achieving gains of more than an inch over a period of 1 year, but these gains are again variable. So I have men who have gained 25 to 30% of their flaccid and erect length over a period of 1 year and have been stable with those gains in the past 5 years, and I've had men who have had no results also. So again, it is important to assess your lifestyle factors and the ability of your penis to handle these gains or to achieve these gains in time. Then comes to the surgical parts or the surgical corrections of or the surgical options that I offer or that we offer to men looking for penile length increase or penile girth increase. So in penile length increase, we have something called as the Plasty along with the dorsal venous ligation, in which we cut away the ligament at the base of the penis, which allows us to increase the penile length by 25 to 30% in a stable form. There are a lot of variations of this technique which allow us to give a length enhancement, which can also allow us to maintain the patient's angle or the patient's support during the erections. Along with these surgeries, they can be added up surgeries like the Penuma silicone implant, the Penuma modified Indian silicone implant, silicone fat injections, Lipolysis fat injections, dermal fat grafts, which can be utilized along with the length extension to give very good girth extension to men along with when they are undergoing a length extension. Surgical procedures are usually reserved for refractory men in whom non-medical or non-surgical or non-interventional therapies have failed. Sometimes men undergoing penile implants at my center for erectile dysfunction also wish to have length and girth gains. In those men, I have a separate video explaining the options, but when we are doing a penile implant, we have much more options and much more flexibility to work on the penis. We can work with many other ligaments that we cannot use during a man who is not undergoing an implant. So if you are looking for a penile enhancement and you are wondering for the correct treatment which is good enough for you, you can always connect with us on YouTube, Facebook, on our website or on email, where we can guide you to the best treatment for you. My advice to you would be to be happy with what God gave you, but if you want something better, there are hundreds of options to choose from, starting from options that are low risk and low gains to options that are high risk but with very good gains. So depending upon your age, your physical factors, your penile ability, we shall be able to recommend to you a procedure that would work better for you. In case of any doubts, you can always comment on the YouTube section and I'll be able to reply back to you. If you like this video, please like it and share it with your friends, and take care and subscribe to my channel.